Good afternoon and welcome to the COVID-19 update on Channel 7, a daily update on the coronavirus pandemic in Nigeria and across the world. I'm Millicent Walker. Happy May Day. First, some of the highlights. Today, Kano in the news again, as reports say doctors in the state abscond from duty posts. Kano also records highest coronavirus cases in a single day. As lockdown measures start to ease, mental health is our focus. And some good news around the globe. 1 million people recover from COVID-19. COVID-19 pandemic surely brought to the fore new challenges in global healthcare. One particular area that is a growing concern to many across the world is the psychological effect the pandemic has not only on those that are positive, but those who are around them, and children are not exempted. Now, even though not everyone suffers equally in a recession, it is just as true that some people's well-being may improve during the coronavirus pandemic. Later on, we would be looking at the impact of the lockdown on our mental health with an expert. Total confirmed cases of COVID-19 in Nigeria has risen to 1,932 following the announcement of 204 new cases by the Nigeria Center for Disease Control, NCDC. The center also confirms that 319 patients have been discharged and a total of 58 deaths recorded. Of the 204 cases, 80 are in Kano, 45 in Lagos, 12 in Gombe, 9 in Bauchi and Sokoto as well, 7 in Borno and Edo, 6 in Ogun, 4 in the FCT, Akwa Ibom and Bayelsa, 3 in Kaduna, while 2 cases are recorded in Oyo, Delta, Nasarawa, Ondo and Kebbi states have 1 cases each. A state-by-state breakdown puts Kano at 219 cases in second place. That is after Lagos, that now has 976 cases. You can see all the states and their numbers updated today. Now, reports from Kano state government is the confirmation of the 80 new COVID-19 cases. Kano now has a total of 219. Now, recently, the Kano state has been in the eye of the storm following reports of unexplained deaths, which the government and the federal government is investigating. In the meantime, while the state is under total lockdown, the ban of interstate movements and restriction of social gatherings, among other directives, our correspondent Nanchin Vincent reports that most doctors in Kano public hospitals have absconded their duty posts for lack of personal protective equipment, as PPEs. Elsewhere, for the first time since the outbreak of COVID-19, the information on the treatment has surfaced from the governor of Bauchi State, Mr. Bala Mohammed. The governor was speaking in a special media briefing in the state capital, where, according to him, of course, we know that he suffered the coronavirus and himself, and said that he was treated with chloroquine and Zithromax. He is recommending it as a treatment routine to coronavirus patients in the state.
These increases that we have recently, about 18, has risen our own cases 29, 6 have gone, 23 on admission, there is no death. Our medical team are using their own acumen to use chloroquine and Zithromax and other things, even though in some places they said it is not protocol. Me as a governor have taken responsibility. I don't want anybody to die. I have given you directive, you must use something that I have used to get well, and you have used for all the other things to get well, rather than saying that something is harmful when we are used to taking chloroquine in Nigeria. We should not follow what the Oyibo people are saying, not taking anything and dying. We have taken responsibility, and I have taken responsibility. Zithromax and chloroquine are not harmful to our body. Our physiological system is adapted to it. If there is malaria, we take chloroquine.
Well, joining us on the program is Dr. Ainoye Komi, a psychiatrist. She joins us talking about well-being and mental health of the lockdown this period. We also have Dr. Adora Enechukwu, GP Registrar, Emergency Medicine London. Thank you both. Welcome both of you to the program.
Thank you.
Thank you.
All right, let's begin with you, Dr. Oyekomi. As a psychiatrist, especially seeing as children are affected differently by the virus. But then when we bring a look at the lockdown, what kind of toll does it have mentally for our children?
Okay, now let's begin this way. Before the pandemic, we all had a life and everything just changed. Now life is about changes, but when the change is abrupt, it can have very, very dire consequences, especially on children. Because a lot of parents will think that, oh, they are children, so they would outgrow it. They are just passive recipients of what happens in the environment. That is not correct. As an adult, you are a product of your childhood. You're a product of biology and experiences. So your psychological profile, the way you handle stresses like this and other stresses in life is already determined as a child. So for children, it's important that parents should know what to do and what effect it will have. Because for children, their brains are still developing. And when the brain is still developing, any form of maybe physical or psychological insult can have great consequences on the children. Because in childhood, what happens to us as children would actually affect the architecture of our brain. And the brain is the organ of the mind. So take, for example, some children will think that, okay, so life can just be disrupted. So why do I have to bother myself? It can just happen. Maybe let me just resign to fate, it's destiny. And then some children, it can also bring in them this pathological sense of uncertainty. So, and if it's not managed well, they can grow up to become either vulnerable adults or resilient adults. So what should parents do or caregivers?
We'll come back to that because some parents are also reporting that children are stressed. Instead of playing with each other, they're pouring out frustrations on one another.
Yes.
But let's go to Dr. Adora Enechukwu. Tell us, because we heard the Prime Minister yesterday talk about mental health that is rising, and this is following the lockdown as well taking place in the UK.
Yeah, definitely. I think mental health is always such a big issue, but I think everybody is going to be affected by it even more, especially people who already have underlying mental health conditions. I think a big part of it are things like loneliness. Effectively, you are cut off from your normal support system, and it makes it difficult to manage that. And I think as well, a lot of people are working from home. So while there might be positive aspects of it, that can also bring different aspects as well. Because if you're pardon?
You could continue.
Sorry. So if you're working from home, there are also different concerns with regards to that as well. First of all, not everybody will have a job where they can work from home. So there'll be lots of concerns about finances. The government is, luckily providing that for a lot of people, but I think finances will definitely be an issue. And some people will struggle in terms of childcare and working from home. So you have to sort of set up effectively a homeschooling routine for your children if you have them, as well as, attempt to do all the things you would normally do.
Let's come back to Dr. Ikomi here in Lagos. The Almajiri children are an important group. We've seen some of them being moved from states to states this period. Some of them are also testing positive to COVID-19. Some of them are also orphans, and some of them, their schools are closed. This must be a tough one, a tough period for them.
Yes, so the effect of stress is not only on the children that have everything going on for them. It also affects other children, from poor socioeconomic background, because even this our majority children were used to a certain lifestyle before, and now everything has changed. So what stress does in a child is actually to make that child's psychological, to build the psychological profile. But for an adult, we'll say that stress can break, but for a child, it actually makes. So it would determine the type of adult they grow up to be. So it would form like a psychological template against which other events will be judged. So their appraisals, their perception of events of life when they become an adult is going to be formed now. So that is why they need to be taught some life lessons. The fact that they are not in school does not mean that they cannot teach. They cannot learn some other things. And in fact, life lessons are even much more important than academic lessons, because it's those life lessons that will help to determine how far you go in life. So, for example, now, parents can tell their children, you see why we had to save? Or maybe we did not even save enough. So you can begin to teach your child that frugal lifestyle, so that they can anticipate changes, because life is about changes. Nobody is promised of a very, very serene future.
And is there a certain age you think that this teaching should start?
It should start as early as like 1.5, because when a child begins to have self-concept around the age of 18 months, then you should begin to teach them this life lesson. So when you teach them that, yeah, it's good to save, it's good to plan for the future, you are teaching them a form of delayed gratification, which is a critical part of self-discipline. It's very, very critical. And other things that there are so many things you can teach, but I'll just touch on very, very important ones. Another one is you teach them structure. Now, a lot of times this time around, parents just leave their children rather to watch TV. Some children watch TV late into the night, 3 a.m., 2 a.m. It disrupts their biological rhythms, and it can have effect on their psychological development.
Okay. Let's quickly go to Adora. Back to you, Adora. Looking at healthcare workers this period, I'm sure that they're also going through a lot of stress. How are you keeping things together, especially seeing as, you're working in London, and we know that London has the highest number compared to other areas in the UK?
Yeah, I think as I've stated before, it has been very difficult, especially if you're working, in the acute medical setting on ITU. A lot of us are seeing things that we've never seen before. The amount of death that we're faced with and seriously unwell people it has a serious mental toll. One of the good things that definitely my hospital has set up, and I think some of the hospitals have arranged, are things like wellness centres. So there are places where staff members can go and do things to sort of help de-stress and help with their mental health. So, there's things like, being provided with lots of free food, meditation, exercises, yoga. They're trained volunteers, as well as, therapy staff and things like that are really helping in terms of us at work when we need to de-stress. So that's something that's been really helpful.
We're working with the emergency medicine there in London. We hear that, I'm not sure you heard it, but the Bauchi State Governor saying that treatments with chloroquine and Zithromax helped him recover from COVID-19. We know that the UK has started some vaccine trials as well, and saying they will be out in May. What's your take on the treatment module for the governor here in Nigeria and what's happening over there?
I think the important thing to realize is that the healthcare system in obviously Nigeria and the UK is very different. We have a different population, makeup as well. Here, we're not, we're not recommending chloroquine or azithromycin or things like that. Although it has been suggested that there are important, they may have important effects. I think for us, some of the aspects and areas that we've been going into are really the issues in terms of vitamins. So there have been lots of quite early studies, but studies talking about the importance of vitamin D and vitamin C, and the fact that deficiencies in those, especially in Black people and Asian people, and people who live in deprived communities, and are in quite what we call multi-generational living, so situations where you have a grandparents, parents, children, they're more likely to have it. So we're sort of focusing on that in terms of vitamin deficiencies.
All right. All right, Dr. Adora Enechuku, GP Registrar Emergency Medicine London, thank you for joining us at this time.
Thank you for having me.
And Dr. Ikomi, I know you said you had two more things you wanted to say with parents and how they can help this period. You just have 20 seconds.
Okay, so the second thing they can teach them is how to structure their time. Time management is very, very important. So the fact that you have so much time on your hand doesn't mean that you should just do things just be playing game, just like that. You have to manage your time to do constructive things with your time. And then the third thing is empathy. You can teach them empathy. Use this period to teach them empathy, to to make them learn the lessons from sharing, to let them know that there are some people that do not have. The one you have, you can share. So all these things will go up, will help them in building a very, very solid psychological profile for them as adults.
Right. We appreciate your time, Dr. Aino Yekami. Thank you for joining us on the program.
Thank you for having me.
Still to come on our COVID-19 updates, we tell you what's happening around the globe. Join us again. Welcome back. From across states in Nigeria, they continue to adopt varying measures to curbing COVID-19. Let's begin with the Oni of Ife, Obade Ogunsi, who says the COVID-19 pandemic is like a war, which requires the brave intervention of traditional rulers, customary of their statutory roles by history. The monarch also donated some locally fabricated motorized fumigators and drones to the Ekiti state government, highlighting the importance of massive fumigation as the post-lockdown steps come alive. Also in Ekiti State, the governor, Dr. Kayode Fayemi, has appointed Mr. Femi Adeoye as a COVID-19 response ambassador and a member of the state's COVID-19 task force. This follows his recent action against his own son to protect the state from possible further spread of the virus. Now, Mr. Adeoye became famous after a viral video showed him demanding that his son, who just returned to the state from an epicenter against his advice, be isolated for 14 days before coming under his roof. Presenting a commendation letter to him, the governor applauded the retired FRSC officer for his action. Now, away from the southwest, Governor Abubakar Bello of Niger State has called on civil servants and the organized labor to abide by the safety measures put in place by health professionals and government orders aimed at containing the spread of COVID-19. As they mark May Day celebration, he urges them to maintain the practice of personal hygiene, commending the organized labor for their understanding with the government at this period. And Yobe records an index case of coronavirus. A 29-year-old man who had no travel history, he tested positive to the virus. Residents are calling on government to take more proactive measures to curb the spread of the disease in communities. Those who spoke to Channels Television lament that time has come for government to shut down markets, worship centers, and other social gatherings. All intra-state movement in Plateau State has been banned in order to curb community spread of COVID-19. The governor, Simon Lalong, in an address on the continuation of the lockdown, announced a ban of no movement from local government to local government in the state, as well as a ban on all entry and exit points to the state. Now let's find out how Bayelsa State is faring today with a record of 4 COVID-19 cases. Our correspondent Dobra Timewu tells us about the restrictions in place and the compliance levels.
There's usually lots of activities, specifically commercial activities in this area of Yenagoa, the Bayelsa State capital. In fact, this area is known as the go-to place for the purchase of mobile phones and other electronic wares. But for the past 3 days, all these shops have been closed due to the ongoing lockdown in Bayelsa State to curb the spread of the coronavirus. Now, Bayelsa State has an index case, and the state government 3 days ago gave a directive that all commercial activities in this area, not only this area, other commercial activities, except those selling food items and pharmaceuticals, should stop in order to curb the spread of the virus. But the owners of this shop says the continued closure of this shop is adversely affecting them as they gain their daily earnings to feed their family from sales made in these shops.
We are the workers that maybe sometimes we'll come to the shop, work, whatever thing that will work is what we'll take and go and eat. So since that lockdown, we cannot come and work again, we cannot do anything, we're just standing out. The little one that we have eat it.
I do hair, I'm a stylist, I make hair. And right now there's no customer coming in the shop. Expect boys to do when there is no food, no means of working. What exactly want us to do? To stay in the house indoors, doing nothing.
Only vendors selling food items and pharmaceutical supplies are permitted by the Bayelsa State government to still engage in commercial activities. Vendors selling other non-consumable items are calling on the Bayelsa State government to relax the directive regarding the lockdown, as they may not be able to survive if the lockdown continues. From Yenagoa, Dobra Timiwood.
Still talking about strategies to curbing the spread of COVID-19. Joining us in the studio is a public health physician, Dr. Okpeyemi Osunyomi. Glad to have you on the program.
Thank you very much. Good afternoon.
We're seeing a spike in Kano. Can you tell us what's really happening there?
Well, the Kano issue still seems to be eating, like there's still something eating that's still not sure. You know, like when they first happened, fine, I think they first had like 5 cases, and I think they had a travel history from Lagos and all that. Then there was a 16-day case who was not connected to any travel history. And then, then they said they are having this seasonal thing that occurs yearly, and there seems to have a lot of death. So that's kind of mixed up with this COVID-19 emergence also in Kano. And another thing that I could say is the attitude of the people themselves. You know, when the COVID-19 thing was first mentioned in Kano, the people were like, it's not possible, it's not true, there's nothing like COVID-19. They went on as usual. There was even a case of, there was this video that went viral of a guy washing his hand in water and then drank the water after that, like just to mock the government that there's nothing like COVID-19. There was another video of a football match that a crowd, it was like a stadium. And if anyone, just 2-3 people have COVID-19 there, it's just very easy for them to spread. So I think the attitude of the people must have really, because they didn't take the necessary precautions.
The governor also said something. He expressed worries over religious and traditional misconception around the pandemic. How do you think this can be helped?
Well, one of the things is we are a very religious people. We're also a very cultural people. And, you know, that makes us to be like, we have a lot of trust in whatever our religious leaders says, whatever our traditional leader says. So if you have a religious leader who goes on here or who goes to the public and says there's nothing like this, don't mind them, it's all a lie, or there's something you can use, like it was also in Canada that they said some people were selling so-called vaccine that can cure COVID-19 if there was anything like that. So if you have a religious leader or a traditional leader who goes on to tell you there's nothing like that, don't believe them, obviously the people will tend towards that, and whatever precautions that might be coming from the state government or from the federal government, they may not take it serious. And that would just help to spread because life will just go on as usual.
Finally, what do you think tracing, testing and contact tracing would look like as we ease into picking up the economy again?
In fact, that is one area that I think is giving, but I believe we should be able to overcome it. We have overcome a lot, especially in Lagos State. It might not be easy, but it's not impossible because right now you're going to have people back on the road. And Lagos being a commercial center, Lagos being the most populous state in the country, you will have a lot of people who will come out really because it's like they've been in prison for about a month, and now you give us an ease, people are going to take that opportunity and we're going to have a lot of people going out. So, you know, the contact tracing that it was easy for us to meet people at home and all that might just be affected somehow. But I believe one way or the other, we will be able to overcome it. And really, they should cascade it well to the local government level because those are the people that know their people. They are the grassroots people. So they can tell you where, if someone is not at home, they probably will be able to tell you where you can find the person and you can meet and do all that is necessary to be done.
We appreciate your time, Dr. Okpeyemi Osunyomi. Thank you for joining us on the program.
Thank you very much. Pleasure is mine.
The number of recoveries from COVID-19 has hit the 1 million mark globally. Despite the recoveries, there remain more than 2 million active coronavirus cases. And more on that story is followed by Germany, which has recorded 123,500 recoveries out of 163,000 cases. Also, Spain has the world's second highest confirmed cases of over 213,000 and has recorded 112,050 recoveries. China, where the coronavirus originated last December, has recorded 78,523 out of nearly 84,000 cases. Italy, which has confirmed the highest fatalities behind the US, has seen recoveries of 75,945 out of over 200,000 cases. Worldwide, the number of confirmed infections stands at more than 3.26 million, with some 233,000 deaths. Now, take responsibility in protecting your health. The NCDC says you should practice physical distancing by no contact greetings, maintain at least 2 meters between yourself and others, stay home if you feel unwell, call your state hotlines, no religious or social gatherings. The website has all the information and statistics that you need. Well, that's our COVID-19 update at this time. Another update comes your way again at 6 p.m. I'm Millicent Walker. Bye for now.